Hello, and welcome to the Implant Ninja Restorations 101 course. My name is Nancy, and I will be your artificial intelligence guide for the duration of the course. Although you'll also hear from Dr. Ivan Chikon and Karl Pogenchef, I will be your host that walks with you from start to finish. In this course, we will go over the basics. We will demystify all the parts and pieces involved in dental implant restorations. We'll cover how to identify when an implant is ready to be restored and how to properly take impressions. Then we'll get into the nuts and bolts of how to fabricate something that is built to last. By the end of this course, you should be able to be restoring 90% of the implants that walk through your door. Are you ready? Let's do this. Hello, and welcome to the Implant. In this first section, we will go over the tools of the trade. We'll look into all the little bits that are used for implant restorations. First, you'll do a quick review with some slides. Then, we'll go just a tad bit deeper with demonstration by Ivan and Karl. If it seems a bit basic, bear with us. The procedures are very basic, but the nuances get complicated. If you pay close attention to the details about the various implant bits, you will master this stuff in no time. Let's get into it. So you can probably see now that while it seems a bit basic to say you only need a wrench and a driver, it is actually much more complex than it appears. A wrench has many different variations. There are big wrenches and small wrenches. There are some wrenches that allow for adjustable torque settings, while others are fixed settings. And there are different types of wrenches that are incompatible with one another, such as the square socket, hex socket, or circular variations. Also, you've seen that there is some variation in the impression-making attachments. Now in this next video, Karl and Ivan will do a little show and tell to review the parts for you.
So these are all the instruments that we've talked about up until now. We got our wrench, we have a driver that goes into that wrench, and then we have these 4 different variations of what attaches to the implant. Sorry, they're kind of rolling around here. So 4 different variations. We got our scan body over here, open tray, impression coping, closed tray with basket, and closed tray without basket. There's one more thing that I want to introduce here, and that is this little hand driver. This little, I call it a thumb grip. Hand driver is a little confusing because there's another thing that's called a hand driver too. So this thing, basically, you can put your driver into it. Oftentimes, the driver and the hand, little thumb grip or hand driver come as one already, so they don't come apart. But this is basically if you want to take your healing abutments off, on and off, and put these little attachments on and off. So this is just getting parts on and off of your implant without actually adding any sort of torque value. You don't need to measure any of the torque that you're adding when you're using this guy. When we do want to measure torque is when we're delivering stuff on your implants. So if you're delivering a final abutment and crown, you'll want to use this guy because this has a little setting right here that you can establish how much force you want to put on your screw, on your prosthetic screw, and you can calibrate that here. And there's various settings you could put it at. And now remember that all of these wrenches, or a lot of these wrenches are different from each other, right? So this one has a little square attachment here, and the reason for that is it belongs with this driver right here, this little square driver. And so that inserts there, and you have to just be very mindful of that because not all of the wrenches go with all the drivers. Often you might run into a little container that's got a bunch of different stuff and none of it's compatible with each other. For example, I just randomly reach across the desk and grab this guy. This will not accept this driver. Watch. So you might think you have the parts and then you're not going to be restoring anything like that, right? So it's just something to be aware of. You want to make sure that as you start to build your implant armamentarium, that you make sure your stuff is compatible and that your assistants are highly trained in what's compatible too. So let's go over really quick these parts. But before we do, I just want to point out something that's very confusing is these driver tips. These driver tips are varied. These are different different tips for different systems, and it can be a really, really big problem. So I'm going to make sure to discuss this in the next section, okay? But I just want you to know that right now that we're going to talk about this and why it's important that you know that there are a lot of different variations that you need to be familiar with, okay? So let's go ahead and just do a quick overview of this. So scan bodies, they look like, well, they look sort of like this. I'll show you another one. Let me grab one. I got another one right here. Now, best practice is to ask your laboratory which scan body they recommend you use, because at the end of the day, your laboratory is the one that's going to be having to import this into their, or import the information into their database and match it up and make a crown for you. So they have to tell you which systems of scan bodies that ultimately will work the best for them. So there's a lot of different kinds. You should ask your lab which one to use. And that's used with the intraoral scanner, of course. And then we have this guy, the open tray impression coping. Now this has a long screw that goes into it. I like to use this for impressions on bridges. Right, so impressions on bridges, this is pretty convenient because you can actually lute the two together, these two impression copings together. Oh, not these two, there's only one here, but you can lute two impression copings together to just add an extra layer of verification to your impression. Now, if you're using digital, well, that's accurate as well, so you don't have to do that. Now, this guy right here, this is an impression coping. This is a closed tray impression coping. That means you will not be making a hole in your tray and modifying it. It's closed tray. You're basically just taking an impression like you would a regular crown, and this part will be picked up in the tray. So this part goes on the implant, and this part gets snapped together. Don't worry, I'm going to show you all this, but right now I'm just quickly going over it. These parts snap together, and then they snap together, and then you take an impression, and when you pull the impression off, that thing just comes out with it. Okay, and the last one here is, please excuse the this piece has been modified a little bit. See how I burred it right there? I drilled it a little bit. But anyway, this last piece is a closed tray impression coping without a basket. So this part just gets screwed onto your implant, and then you take an impression on it as if this was a crown prep. Okay, and then you pull out your impression. This stays in the mouth. You'll see this has a little screw in there too, but that screw, you don't have to remove the screw to remove the impression. You do, however, with this open tray impression coping, you will be cutting a hole in the tray, and you will be having to remove this little screw before removing the impression. Otherwise, that sucker's not coming out. Okay, so that's just a real quick overview. I hope that clarifies just a little bit, but basically your tray will be looking something like this. There's three parts to it. There's a wrench, there's a driver, and there's whatever attaches to the implant. All right, let's move on.
In this next video, we call on Dr. Carl Poggenchef for some help. He'll show us a variety of wrenches and explain the ins and outs of each different type.
All right, Carl, so what are we looking at here? What are we using for our implants?
So we've got a whole bunch of different types of torque wrenches here. There's a lot of different kinds here, so it can get a little bit confusing. So we're going to try to go over some of the types that exist. There are some that are adjustable, and there's some that have set torque values. So I think that's the first way to break it down.
Okay. So the adjustable, I mean, these all are kind of adjustable in their own way, right? No, wait, that one's not. Yeah, so adjustable, non-adjustable.
Right, so these torque wrenches here have one set torque value, but you can change it. So for example, this one that you see right here, right now it's set on 35 Newton centimeters, but if you actually go and twist, you could change it to 25, and there's quite a range that you can do there.
I see, so right here we can just change the torque values.
That's right.
So whichever one it's pointed at, that's the torque value that it goes to. And that means that when you turn it, it's going to take it to that value, no more than that.
That's correct.
Sweet. And this one kind of goes up to 60, and it doesn't go past 60. So that means, I mean, should you be torquing anything past 60 anyway?
There's nothing really that needs to be even torqued at 60, but usually most of them are, you're either going to use 15, 30, or 35 for most systems.
Okay. I mean, the only time I can think of to use more than 60 is like if you got something stuck and you're trying to get it out at all costs, and you can like put it at infinity or something.
Right.
Right.
There are some that have infinity, but that one only goes up to 60. This one actually might, one of these two might have an infinity right there.
Yeah.
Oh yeah. So this adjustable one has the infinity marking on it right there. So that one can be used to infinity. There's not a ton of great reasons to use infinity, but it's there if you need it.
So you can take it to 10, 20, 30, or infinity. Okay, and these are basically the same, I think.
Yep, that one's sort of the same. This one has a little bit different part right there.
So this one has a little square there, right? A little square right in there.
That's right.
And so some things that are square, they fit in, right? So this is those drivers we were talking about before. Those are square, so they fit right in there. But not all parts have square drivers, right? Some have a hex. So this one looks like this one's a hex. But essentially, they're otherwise basically the same.
Right. Well, this one right here has an interchangeable part too that you can switch to the square connection as well.
Got it. So you can swap them back and forth. Okay.
Right.
All right. So what else do they have to know?
So those are your adjustable ones. And now you're kind of over to the ones that are not adjustable. This one is the common one from Nobel, and it does have different torque values, but it's not really adjustable. So how this one works is that you hold onto it, and then the bulb can shift, and the bar hits the torque.
So as you're tightening, you just pull on this little teardrop, this little bulb, and when it gets to that first one that's 15, gets to the second one that's 70. Oh, that kind of hurts.
Once that bulb flexes out, then you know you've hit the torque. So there's not really a clear snap like you would on the other torque wrenches, but if you're looking at the torque values, when you get to that number that you need, you can stop.
So one thing to mention, although we're showing, pushing the teardrop thing like this with my thumb here, I'm only doing that for instructional purposes, right? In the mouth, you're not putting your thumb here, otherwise you're basically skewing the torque value. You're putting it on, and then you're just pushing that way, like that. All right, so tell us about these guys.
So this particular one is one that I actually like a lot. It's pretty simple, it's not adjustable, but then when you hit the torque, it'll snap and break there. So in this case, it's 30 Newton centimeters, and then when you achieve the 30, it'll let you know by snapping.
So basically, you put your little restorative driver in there and put it on the screw, and it keeps going until it breaks like that, right?
That's right.
Cool, and you got to 30, and then that's done. That's what you use for delivering your final restorations.
Correct.
Sweet.
So one of the other things that can be sort of tricky if you're doing surgery, this is a surgical driver. It doesn't have any sort of torque limits. It basically has unlimited torque. So it has its uses in implant placement, but when you come to restorative, you definitely don't want to use this one because you would have no idea how much torque you're actually using. So one of the other tips for how to use these drivers, we can show you on this model here. When you're placing this in place, it's good to actually use two hands. And so once you have the driver in the screw head, so when you have it in place, it's good to have one finger holding on top of it, and then your other hand will operate the driver. So that's a good tip for how to use the torque wrenches.
Because you want to make sure you firmly seat it down, or else that thing's gonna slip, right?
You don't want it to slip. You got to make sure that it stays in place while you're using it.
So Carl, one thing I don't know if it's happened to you before, but sometimes these things just all of a sudden don't work.
Right.
Right.
Yeah.
Tell us about why. Like what might be happening?
So especially with this type of driver, you can kind of hear there's clicking going on, but what can happen is there's a little tooth right there that sticks out, and that engages with the side of this handle, and it clicks on those little notches. So that right there is what actually activates the torque wrench. But on the other end, there's a part right here, a screw that you can take in and out for autoclaving, and it can actually come all the way out. What tends to happen is sometimes it gets a little bit loose, and so then the tooth that sticks out there is not engaging anything. It's not actually sticking out.
So those things are connected, right? That little engaging piece and that little screw in the back. So if you loosen it, then your torque wrench is just not going to work.
So you can see as we're starting to tighten it down, that tooth starts sticking out more again. So that's one thing to keep an eye out for if you're not hearing that clicking and you're not getting torque. The other thing to look at on this one is there's an arrow. So that arrow has to be pointed in the direction that you're going. And one of the cool tips with the no bell driver is that it actually says no bell. So when you're trying to torque it down,
See the no bell there?
Right.
Let's see that arrow again. That arrow right there. So that arrow is pointed where you want to go.
That's correct.
So that's like another reason why you would unscrew this thing, right? You unscrew it, but do you unscrew it to switch direction? Oh no, you don't have to.
you just flip it.
You just flip it.
But that arrow could sometimes be pointed in the wrong direction.
I see. Okay. So one other thing that's happened to me is that little engaging part right there breaks. The thing has snapped before, and I wonder what's going on, and it's just that thing broke and you got to get your torque wrench replaced. Now, weird question here. Somebody asked me, do these guys always stay calibrated? Do they stay at the torque value that they say they're going to be at? And to be honest, I've never really felt the need to calibrate in my practice. Maybe I probably buy one of these every couple of years or something, but I've never calibrated. Do you do that, or do you recommend it?
Well, I haven't myself calibrated, but supposedly as you autoclave these more and more, it does change the torque value. Particularly with this particular type that has the break point, the more times you autoclave that, the more resistance there is to breaking. So after many autoclave uses, even though it says 30, it might actually take 35 or more Newton centimeters to break this neck. So the risk you run after you've autoclaved this tons of times is that the torque value might not be accurate anymore. Supposedly the bar and teardrop type stay accurate for longer.
Really? I would have thought they would be less accurate, but okay.
But I don't know. They both have the same issue with repeated autoclaving.
Got it. Okay. So maybe we should just be replacing these every couple of years?
Every now and again it makes sense. It makes sense to get a new one.
They do sell these calibration devices on Amazon. I really don't know how valuable it would be compared to just buying a new one of these, because it's not like, the cost of that calibration tool is going to be the cost of one of these guys anyway. So I don't know, I might just want to have a couple extra.
I wouldn't be super worried about the calibration, but it is something you should keep in mind.
Awesome. Should they get something like what's the benefit of getting this big one with multiple values? Like this thing's $500.
Right.
This is an expensive torque wrench versus these guys. These guys might be like, I don't know, $150, $200.
People like the adjustable. People like the adjustable ones because then you can use the same torque wrench with a bunch of different drivers. Because one implant system might be 30 Newton centimeters, one implant system might be 35. So the benefit to having a more costly adjustable one like this is that you can use it across multiple implant systems, whereas the one that's a set torque value can only be used for that specific implant system.
And this one's cheaper, right? This one's cheaper to purchase. This one's kind of like a sliding torque value. I don't know, somehow this one seems more accurate. This one seems like it'd be like better machining.
It just feels sturdy.
Right.
That's for sure. This one, I have this one and I used it a bit, and it's a little bit bulkier, so sometimes it can be a little bit harder to fit it in tight spots in the person's mouth.
That's true. I have this, but I don't use it.
Right.
I just use this one because it's easier.
Same. I have this one, but it's probably the one I use the least.
Right, and it's the most expensive, so probably, what are we thinking? Just having something like this is fine. Having something like this is probably more versatile.
Right. This particular one is my personal favorite because it's the easiest to use, but if you have this set torque value wrench, you have to have a few of them instead of just one. Whereas if you just have one, this might be the way to go.
Awesome.